if you want to do research, so what is the procedure for doing research? So if you mean how to do research thesis during your MD emergency medicine residency in Pakistan, this process is actually quite manageable. If you start early, PMDC regulation recognize research or dissertation as part of level 3 postgraduate programs such as MD, FCPS, MS, and require postgraduate programs to provide opportunities for scholarly work. Your MD research pathway. First of all, find your supervisor. Choose an MD faculty member or consultant interested in research. Ideally, choose someone who has previously supervised postgraduate research. Discuss 2 or 3 possible topics with them. Learn the basic methodology you should understand. First research question, study design, PICO, sample size collection, inclusion or exclusion criteria, data collection, bias or confounding, basic biostatistics, SPSS, literature search, referencing, ethics or IRB approval. CPSP similarly requires trainees to undergo research methodology training before preparing their synopsis. Select a practical emergency topic. For you, I would strongly recommend a topic that can be completed within your emergency department without requiring expensive investigation. The example includes pattern of electrolyte abnormalities in patients presenting with sepsis, predictors of mortality among patients presenting with sepsis in the emergency department, prevalence of hypoglycemia among patients presenting with altered level of consciousness, accuracy of Q-SOFA versus News2 in predicting deteriorating in emergency patients, prevalence and causes of acute kidney injury among emergency department patients, factors associated with prolonged emergency department stay, antibiotics administration time in patients with suspected sepsis, knowledge of emergency nurses regarding crash cart medications, compliance with CPR or BLS protocols in emergency department. Your earlier idea, pattern of electrolytes disturbance among patients presenting with sepsis, is actually reasonable starting point. Write the synopsis. A typical research synopsis contains title, introduction or background, literature review, research question, objectives, operational definitions, methodology, study design, study setting, study population, inclusion or exclusion criteria, sample size, sample technique, data collection procedure, variables, statistically analysis plan, ethical considerations, timeline, references, data collection, proforma or questionnaire. Do not collecting data before the required institution or academic approval. CPSP's current guidance explicitly says research data collection begins only after the synopsis approval and ethical requirements are fulfilled. Get the ethical approval. Submit your protocols to your institution ethical review committee or IRB according to your university requirements. For your MD at Ziauddin, you should first ask the program director or research coordinator exactly that their current MD thesis protocol and ERC process requires. Calculate your sample size. This is one of the most important parts for you. For example, if your study pattern of electrolyte disturbance among patients presenting with sepsis, you need to determine your expected prevalence, confidence level, margin of error, and appropriate sample size formula. Don't simply choose 100 patients because it sounds reasonable. Collect data prospectively. Create a structure sheet. For example, variables includes age, sex, diagnosis, sodium, potassium, urea, CRET, lactate, outcome. Then enter the data into Excel or SPSS. Analyze the data. You don't need to become a statistician. Initially learn mean plus standard minus deviation. Mean plus minus standard deviation. Median by IQR. Frequency by percentage. Chi-square. T-test. Mann-Whitney U. Correlation. Logistic regression. P-value. Confidence interval. A statistician or epidemiologist can help you with a more complicated analysis. Write the thesis, usually introduction into literature review, then into methodology, then into results, then into discussion, then into conclusion, then into recommendation, then references and appendices. Try to publish it. This is different from simply complicating your MD thesis. If your study is good, you can convert the thesis into a research article and submit it to a suitable peer reviewed journal. What I would recommend for you, because you are an MD emergency medicine resident, don't wait until the last year. Use the sequence. Learn research methodology. Month 1 to 2 find supervisor. Month 2 select the topic. Month 2 to 3 literature research plus synopsis. Month 3 to 4 ethical review committee or academic approval. Month 4 to 12 data collection, analysis, thesis, manuscript, publication. Also check your university's MD emergency regulation because MD requirements are institutional or program specific. PMDC requires the DAI and training site for local postgraduate qualifications to be recognized. Thank you.